Dear friends, it's a proud moment and a proud privilege to welcome my mentor, guide, and philosopher. Let me tell you, I started my accreditation journey with Madam Gracy Mathai. Most of you would know the story as to how CMC faced the accreditation assessment under Dr. Gracy, Madam Gracy Mathai. So it's been, from the time we started, it's been a brilliant association with Madam, and she's one of the very senior NABH assessors, a faculty for NABH. She's straight out of a program on implementation on NABH 5th edition standards. She's the CEO of Baby Memorial Hospital, Calicut, full of energy, full of life. And over to you, Madam. Let's do this together. It's just a discussion. So we all know as assessors, when we go for assessment, CSSD is the area that we like the most, because we know that we are going to be visiting some astronauts there, full of PPE, top to bottom, at least on the day of assessment. Except the headgear, I think they'll have everything on. And still we write a lot of non-compliances, isn't it? With everything meticulously organized. It's an area where all of us like to go, visit, learn, and also write some NCs and come back. So in your experience, Madam, if you can point out the one NC that you have noticed in most hospitals, if you can explain that, it'll be of great help. What do you think is that NC that you have seen the most?
No, not only one, I will have two at least minimum. because where most places what I have seen. See, whatever said and done, Dr. Lallu, see, the importance given by the organization to the CSSD is very, very, very low. CSSD being pushed into one corner with one small room, managed by somehow, you don't know how they are managing even. Except I might have visited more than 150 organization. In this 150 organization, I found, which I can count on my fingers, that they have given real importance to CSSD, and at least some floor, like in your place, you have given one full floor to CSSD. So that way, there are some organizations which they have given. But many other places, it is just a small room. Like in a big bungalow, there is a hut is being given at the corner for the servant to stay, no? So that way it is. So one of the complaint or thing what I am observed is the space or the zoning, but they have not done over there. And second one is with the SUD. These are the two. There are many, but if you ask me 1, 2, 3, 4, the second is with the SUD. They don't know how the single-use devices need to be used or reprocessed or how it should be kept. No such things are known to them. So these are the two most important things what I have seen. Like space is not sufficient. There is no receiving area. There is no separate washing area. Things are washed in the department where it is generator, and that also washed in the wash basin where they wash their hands or they scrub that area. It is banned. So these are the two things what I found over there. No zoning and the space is not sufficient.
Okay. So if we dissect this and see, you brought in a lot of points within that one point, space availability. Often CSSD, we know it is under the staircase or a small room that is provided. And we know there is a certain requirement for a space. Nobody takes it very seriously, correct? Which is what we are trying to do in forums like this, where we are trying to stress the importance and the need for having a good CSSD as the backbone. Now, when you say no space available, that's one point. Second thing is the zoning part. In your experience of assessing 150 hospitals, if you can, broadly say, what percentage of hospitals actually has the zoning as per what one would desire? What would be the number? Approximately.
Less than 10.
Less than 10%?
10.
Okay. So that really gives us, so where are we going wrong?
That is what, see what has happened. They don't want SSI to happen. They don't want any infection to happen. And they don't know what's the importance of CSSD. They think only few technicians are running there. So they will look here and there. And whatever demands are also not met. So what will happen? We have to create awareness on the top management. That is number one thing. They all say that without CSSD we cannot function. CSSD is very important. But giving that value, giving the required staff, giving that place to the CSSD, that things are not happening. So first thing is the top management to be tackled. That is number one thing. That can be either tackled by NABH directly or by Kaho-like people, or as you say that whenever we go, we raise an NC, and you know how they close the NC. They may show something here and there because we are not going and seeing it again. So in order to show us, they will some photo shoot from here and some photo shoots from there, and they submit. And unfortunately, I have gone to a hospital second time. It was on the previous way, like, and there I have asked them. I said, you have shown me, oh, that time this expansion part was there with us. Now it has been taken by someone else. So I have again come back to my original. That is what they say.
Absolutely. So I think that gives us the need to educate the top management. I think the need is to start a training program for the top management to really educate them the importance of allocating space for CSSD.
I think, Dr. Lallu, I think they know the important, but still they know the things are work is managed. You understand now?
Exactly.
So when that is the thing, when work is managed and poor technician, what they do, they don't, okay, you can shut down and then close them over there. So that's why the things is happening.
So it's more and more education, and trying to, people like us probably will have to be a little more strict on assessments. Yes.
And I think it should be led by either a senior nurse or someone. Then at least you see here what happened. A technician is leading that, and that technician is having of maybe 1 year experience, 1 year of not 1 year of training, and maybe having only some experience she or he is having. So people don't give that importance.
All right. So we talked about the space. We talked about the zoning. What is the other thing? You talked about the single-use device.
That is another major thing. See. One thing, they don't know how many list of items they have of single use. That is not aware of them. They don't have a list. Another thing, if at all they reuse them, they don't put any number how many times this has been used. It is like a plain catheter, like it is using as first time. When you ask how many times this has been used, they are not sure. Whether it is used 2 times, 3 times, 4 times, 10 times, they are not sure, because no marking on the catheter or no marking anywhere. So that is another thing. And then what is your criteria for a deposition of this thing? When it torn, or when it is, when that, what do you mean, say, that fibers will be torn out or those particular time till they use that. And again, to which patient it is being used. Again, and then have you informed the patient of that you are going to use, reuse this particular thing? No such things are there. No documentation of that how many. Actually, what has happened, actually, see, each time, even I will, most common use thing I will tell you, our cardiology catheters. And the catheter looks same. Okay. Catheter, when it looks same, so whether it is A catheter, B catheter, C catheter, you cannot make out. So what I tell them, that A, today what you remove, you get a new catheter when you take, you give them A. So that A is there. So this A, how many times you have used? Then the next catheter, when you take new one, that is a B. So then that how many times you have. When it did AB go up to Z, then you can say AA1. Then you can go BB1. Then you can be CC1, like that. So that way you give a particular number to that particular catheter. So that, and then A1 is used for Gracy. A2 is used for Dr. Lallu. A3 is used for so and so. Why? Because we have to trace the infection, if at all any infection is there to this particular patient. So those things are not there. They have to do in that particular way. And none of them have informed the patient that they'll be using the reusable things. That is what I see.
Yes. So that is another major area of concern, and I think we'll have to focus on that. Yes, and there was a brilliant talk earlier about the reuse of single-use devices. And yes, a lot more sessions are needed to educate our hospitals on that. So leaving this aside, which is the other one that you see most commonly, ma'am? Any other non-compliance that you notice very commonly?
Yes, there it is what has happened now, the cleaning the thing in the area where it is being generated. That is again we have seen. Why it is being done? Okay, if they do, I don't mind. Now, even one of the speaker also said that we can clean the thing, but they are cleaning the thing in the sink which you use for your hand washing purpose, or the sink which you are using for your scrubbing purpose. There only they are cleaning. Let them clean it. I also say that let them clean. I don't mind, but at least there should be a separate sink identified where they'll be cleaning this particular thing, and that is also being happening. That's a third one what I observe.
Absolutely. So, you know, this practice of having a separate room in the ward where that is pre-washed, and then there is no cleaning that is happening. That's what JJ was also talking about earlier.
Yes.
Then there is no cleaning that happens in the CSSD. So as rightly Apurva said, it is just a, basic thing so that it doesn't dry up. And then obviously you'll have to have a proper wash in the CSSD. So that practice is often neglected, and which I have also noticed in multiple hospitals. So let us talk about the last major thing, madam, because for want of time.
Okay,
Yeah.
That what has happened, when we go to the ward, we can see that many expiry CSSD items are there.
Yes.
See what has happened. Sometimes those badges, signage is being gone. Then they say it was not of good quality. That's why it mixed with, or it rubbed with each other. That's why it is being gone. So they don't know whether it is expired one or whether it is active one. And if at all out of that, if you take one or two and you really found it might have expired some months back. So
Yes.
such things are there, and without any expiry date and without any batch number. So that will create a problem. One thing for your recall, and
Yes.
another thing, you may use your expired items for the patient because you are not sure. Because that FIFO, they are not looking into that FIFO, first in, first out, keeping the things like, as you said, now our standard tells that how you are keeping the sterile items in the CSSD, same way you have to keep it in the area, wherever you supply that. But that is not happening. In your CSSD, you keep it very properly, very clearly. When it go to the ward, it is dumped into one area. In that dumping, it happen all these things.
Yes, and we have noticed cupboards that are just above the sink and wash area, and there it is just dumped there. So we have a beautiful sterile store in the CSSD, but when it comes to the micro store in the ward, it is basically dumped into one area. There is no first in, first out, and there's a lot of humidity in that area. And as you rightly said, batch number not there, items would have expired, and that would be used. So that focus is often lost, and we write this NC to the poor CSSD. Actual practice is elsewhere.
Yes, in the floor, in the floor.
Exactly. Okay. So this is the last one I'm asking you, madam. Fifth one, which is again something that you commonly have noticed.
See, the people are not even aware about the validation test also many times. Like, see, they don't know that biological.
It's because they don't know, or they are not provided resources.
They are not provided. They are not provided. It's not that they don't know. They are not being provided. So what is the difference between chemical validation method as well as the biological? And why biological we say it should be good? Because that may be costly. That's why they are not giving. Even we may say that for the implant and everything, you should have a biological for every implant batch. So that they don't do. They may do it only once in a week, because somewhere it is mentioned, okay, that can be done once in a week. So that once in a week only they will use that. So that is the other thing what we usually found.
Absolutely. So, ma'am, I think it's very important to write down the list of all these common non-compliances.
Sure.
And it's very important to put it across also to all the top management people. You are a top manager, CEO of an organization, and when it comes from the horse's mouth, it's, well taken. So it's very important that we run a session with you, with all the senior leaders of healthcare organizations, and tell them, listen, this is how your CSSD is. And you will need to focus and improve on the CSSD. So thank you very much, Gracy ma'am, for sharing your time. Really appreciate your energy, and really look forward to having a brilliant session with you very soon. Thank you, ma'am.